Hi there. My name is Dr. Richard Abbey. I had a couple of client questions that I wanted to cover today. And this client has a child with ADHD, and she was wondering what is the history of neurofeedback dates all the way back to the 1960s, where Barry Sperman was commissioned by NASA to figure out if there's a way that he could exercise the brain or do some things with the brain to see if he could help make scientists more seizure resistant. In fact, that's what he did. He first started with cats, and he trained the cats in a very special rhythm called sensory motor rhythm. One group of cats, he trained them to do that brain rhythm with neurofeedback, and the other group of cats, he didn't. And so then he exposed them to the gas that the astronauts might be exposed to, the ones that might cause seizures. The other group of cats, unfortunately, all had seizures and died. Probably one of those experiments that you can't do today, but back then he did. And it was a very powerful thing. That research got extended going into the 1970s. Dr. Sturman was doing SMR for various treatments, including ADHD. Joel Lubar started picking this research up, professor emeritus out of University of Tennessee, really good and dear friend of mine. We recently lost him, but worked with him over a number of years. And what a great man. He picked this research up and had a number of research articles that showed neurofeedback's efficacy for ADHD, and he was looking at other things like learning disorders. Back then, they only used one sensor. Now, during the 1990s, during the decade of the brain, a man by the name of Robert Thatcher, again, a good friend of mine, I've met so many wonderful geniuses here. He was with the National Institute of Health. When the decade of the brain, the government gave them over $2 billion to research and look at the brain and map the brain. Dr. Thatcher took a group of young people all the way down to 6 months, all the way up to age 94, and he did comprehensive neuropsychological testing, and he did brain maps with each one with 19 sensors on the brain. The key thing is that he developed this FDA registered database going back to the 1990s. He's continuing to work on it today. But now we have a metric against which we can compare children to. So let's say you had a 15-year-old boy and he wanted to compare that to other 15-year-old boys who did not have ADHD. What parts of the brain would be important to elevate and train? That's what we have. What was really interesting, though, is Dr. Thatcher further continued with this research. In 2005, he started doing what's called Loretta back. And so that's when you have 19 sensors, you do inverse mathematics, and you can do a three-dimensional image of the activity of the brain all the way down to the level of the amygdala. Now, back then, we could image about 2,500 different locations in the brain. Today, with the more advanced computers and the more complex mathematics, we can image up to 200,000 various spots in the brain, including the power and energy, the connectivity, and the speed of neurotransmission. What makes this amazing is you no longer have to guess in the brain what's going on. When you do medication, you never know what the brain is doing, but when you actually look at the brain, you image the brain, you know precisely what it's doing. In general, what we find in ADHD is right up here in the frontal lobes, you tend to see excessive slow activity. That's why they try to use things like stimulant medication to speed those neurons up. They may be oscillating around 4 to 8 hertz and is excessively slow. Now remember, we have this database to compare it against, right? The communication in the brain are done with hubs of neurons. Now, if you use the brain a lot in these areas for focused and concentration, and we're developing normally, you have normal myelination in the brain. But in general, we find that those areas tend to be underdeveloped. That's why they're moving more slowly. The neurotransmission is slower. And so the great news is we can actually train the brain because we have all this information. If somebody has ADHD, all we have to do is use our neurofeedback system, which not only can image in 3 dimensions, but also can sample brain activity at 128 times a second. Compare that brain activity to the normative database each time, and we can look at trends, right? The brain, and generally what the brain does is it goes, now we're looking at normative values in Z of 0. Z-score of 0. So that's where normative average is. And so we may be going toward normative average, where outside of normative average, maybe we're going too slow. Neurotransmission is too slow. We're underdeveloped in terms of its pathways. Now, if we're sampling, brain activity will get a little better, a little worse, a little better, a little worse. And it does that. If you have that better brain activity and we capture your son or your daughter doing that, then we instantaneously give them a notification. So this is simple operant conditioning. If you do a good behavior, you get rewarded. And probably giving your child an M&M, first of all, is too sweet and ain't too much weight. But you can see if I wanted somebody to do something and I'm rewarding them, that's going to encourage that behavior. You do that with a system. In general, you're doing this by making computer games work with your brain. Or maybe you're watching a movie, YouTube video, whatever it is, and it's dimmed out to 50% grayscale. And every time your brain does that better activity, the screen brightens up. Okay, what's going on? And you do it again. The screen brightens up. And every quarter second, we're determining, did he do it? Did he not do it? Did he do it? Did he not do it? And if we set the level of difficulty, and we can set it to whatever we want to, but generally at about 50%, then people can tolerate that pretty well. And every other quarter second or twice a second, they are getting a reward. And if you come and you do that, you're getting about 3,000 brain push-ups, so to speak, in a single session. Not going too much into the neuroanatomy, but suffice it to say the prefrontal cortex, the anterior cingulate cortex, sometimes posterior cingulate cortex, the cerebellum. There's lots of things that can be involved in ADHD and difficulties with focus and attention. Auditory is a visual is a both. When we look at the brain and we review that, we will show you exactly what we're working on. The amazing thing is this is all database, right? We're looking at a normative database, FDA registered database. We're looking at the brain maps that were developed, doing comprehensive neuropsychological testing with billions of dollars from the US government and moving forward. Over $30 billion have been spent since that project on brain mapping and doing these types of things. And this technology puts all of that together. The MRIs, the MEGs, the CT scans, the neuropsychological testing. So we have a lot of really good sense of what we're doing. And it's actually impossible with a system to get worse because you're only training toward normative average. So if you're here and you just can't use your brain in a certain way, we help you to do it at least within normal limits when you want to. You can be offline if you want and gel out and do YouTube videos, whatever. But now, instead of not being able to focus and concentrate, especially on things that are not intrinsically interesting, you can. So if you're in a learning paradigm and we're doing 3,000 lessons in a single session, now you do have over 85 billion neurons and hundreds of trillions of connections, right? It's going to take a little while. We're starting from, this developmental lag, right? If we're 15 years old or we're 16 years old or even 10, we've been developing our brain and we're starting to fall behind in those areas that are very important to develop so we can focus and pay attention. Now, ADHD is known as some may say a developmental delay. It's a misnomer because that kind of indicates to me that maybe you're going to catch up someday. You're not actually, unless you do certain things like brain training, right? The only thing I know of anywhere in the literature that can help you get better. Now, feedback is not the only thing. We have several methods to actually build up the brain, make it stronger, have the grit to initiate, follow through on your goals and your homework and all those things. What's really cool is we work with you we'll follow up in 3 to 4 months and show you how your child's doing. And do it again. And what we're really trying to do is get them optimized. They can focus and concentrate. We've been focusing on that, just focus and concentration and paying attention. And we all know ADHD is well beyond that, right? Medication can help temporarily with focus and concentration, right? And that's great because it can be fairly instantaneous. The problem, though, is it doesn't fully take care of all the symptoms, executive functions, planning, organization, getting started on things, not procrastinating, having a certain level of emotional control, emotional resilience, higher order abstract thinking. They have not invented a drug or pharmaceutical that you can take that will essentially make you smarter. And so that's part of the big thing, because the only things that medication can do is help you in the here and now. But once it's out of your system, you're back to the same brain. So I don't think a lot of people really have been told about that or really know or understand that. So there's no therapeutic value in the medication once you stop. So if you're 14 and you take it and you stop in 2 years, you would have had the same brain if you never took it at all. You're always going to be behind. What does this look as we get older? Is we have higher risk factors for drug and alcohol abuse, dropping out of school, not doing so well in jobs, and things like that, being more prone to accidents and things. This is something that was near and dear to my heart because I struggled with this myself, ADHD, dyslexia, and then I got a head injury, and it really fueled my passion to figure out, how do I figure out how to make myself better? I'll give you that story in another video, but suffice it to say, I did well enough to actually be a Stanford professor, and I actually elevated this program since then with more neurotechnology and different techniques. The other thing is, look, I'm a neuropsychologist with children, and the likelihood of one of my 3 boys, if not more, having things like ADHD or dyslexia, very high. I needed to know how to help my kids. And guess what? At least one of them has it. And I would say had it because they've done the program with accommodations, killing it at school, focusing and paying attention and concentrating, planning, being organized. What I'm trying to do for my own children and my own family is to provide them with the skills for life. And if I use the medication, knowing what I know and working with adults as well, I know that is limited in terms of once they get out of the house, if they're going to actually take it consistently, the answer is no. You can look at studies on that, but just knowing my own kids, I forgot to take it, or I don't like the way it makes me feel. For me, it just wasn't a great solution to give my kids what they need for life. And some of the things like math and reading were affected by the attention problems, writing with planning and organization, because I've seen so many children, thousands and thousands of children, and the outcomes. I needed to be able to do better for my own family, for myself. And we're in Silicon Valley. When I'm sitting across the desk from parents and they're asking me, and my kid has ADHD, maybe I did the full neuropsych assessment, maybe I didn't. What can you do? You get accommodations in school, maybe get a tutor or executive function coach or ADHD coach. But how's that really going to change the way they can use their brain? And so that's what we developed, because the science is there. There's tools and studies, thousands and thousands of peer-reviewed studies that show this actually works. And the results that we get when clients come in to see us, they might be on medication, maybe the clients that stick with it. And they're like, my goal is to be as good or better if I took medication. And the results we get, if you have mild to moderate ADHD, is that you are going to, if you stick with it, you are going to be better than if you would have been on medication alone. And the kids that come in with medication and their goal is to get off, they're successful at that. And not only can they focus and pay attention, parents almost fall off their chairs when they're doing their homework without being asked. They're finishing projects. Their room is organized, and all these things. Your child's brain is a reflection of the things around them. If their book bag is all out of whack and not organized, their room's a mess, how their brain is. And if we feel that uncomfortable feeling because the room is a mess, that's because their brain is organized. We need things organized. We need a date book and a calendar, and we need goals and all those things. So anyway, so that's answering a second question. What is the success rate? Really depends on the child. We've had kids who are quite impaired with Down syndrome, so that outcome is relative. But if you have a child who's like attending public school, maybe even private school, and they're struggling, these are the kids that do amazingly well. And the smarter you are, the better you do, right? Because it's a learning paradigm. Some kids take a little bit longer, some kids a little bit quicker. It just depends on how severely you're impacted, how consistent are you, and what is your learning curve, right? But really, we do what we've developed, what others, there's thousands of people doing neurofeedback throughout the world. I would say that not everybody chooses to do it at the level that we do because it's very technical. You have to have a lot of understanding in neuroscience, but we're in Silicon Valley and people want the best outcome for their kids. So we've spared no expense in getting the top systems so we can actually have the best results, looking at over 200,000 metrics and helping a child. And then you just look out and get out of their way. And you don't have to worry about their future because you know that you've given them everything that they need to do to succeed. And they're pursuing their goals. And that's what we want for our young people. Now, the final question here is an interesting question because there's some variability to that, right? And it really depends on how old you are and your response to the neurofeedback. If you have a 8-year-old, and we're looking over time, what I suggest is doing an annual brain checkup, right? So we check our teeth. If we get a knee injury, we're imaging that. Why aren't we imaging, looking at the brain, spending more than the 20 minutes we get a year with our pediatrician? The only other people that are really looking at our child's brain are teachers, and they have a class of 20, 30, 40 students. I don't have time to do this, but we do. And I do. I have my kids and I check their brains just like I would their teeth and everything. But you got a 15, 16-year-old and they optimize their attention. There may be some opportunities in the next year or two before they go off to college. You have really sharp, well-developed attention at 15 and 16. You see these really sharp students that are able to just kill it and nail it in academics and everything. That's going to take you a long ways. And you start losing them 18, 19, 20. They're busy. They're doing their own thing. My experience is the kids that have done that around this age, I've seen them go off to colleges and be amazingly successful. We worked with her child around that age range, 12, 14. And she not only was a straight A student in high school, but then she went off to college, summa cum laude, and now is getting her master's degree. It's really about the untapped potential in your child. For me, just doing neuropsychological testing, providing diagnoses, maybe helping support with medication, accommodations and things. I wanted something more for myself, my own kids, and really the clients that come to see us. It's not for everybody though. And I understand that some people are comfortable taking medication. People should just know that there's a lot of things that will go untouched that once the child or maybe young adult stops taking it, they have a brain that unfortunately is going to be underdeveloped. There's no getting around that. There's no medication or anything that helps you get beyond that. The moment you stop, you're back to the same brain. And so these are things that we do with the children in Silicon Valley, and it's long lasting. The great thing about the brain, it's not like a muscle because your muscle atrophy if you don't exercise. But the great thing about a brain is you get it to a certain level and you're in school and you're using it all the time, right? You go to college and you go to your job and you're using your brain to focus and concentrate and plow through those books. Use your executive functions to do higher level things like calculus and physics and now computer science. For me, I'm concerned about where is AI going to take us? And so the extent to which we can better prepare our kids for higher order, higher level thinking, I'm going to have to worry about them less, right? Because I don't know what kind of information, I don't think any of us do. But for me, I think it's risky not to do these things. It's not to say you can't do it later in life, in your 20s or 30s. It's just that my experience is that most people by that age have come to accept their condition. And it is really difficult unless life has gotten really painful for them to do what's necessary. When you have a child and you're supporting that child, it's much easier to get through a training program like this and set them up for life. Anyway, that's what we do. Hopefully this has been informative. I'm happy to walk you through any and all of your questions or anything that I talked about on this video. Have a great one.